We are unfortunately seeing a substantial increase in the daily case counts of the coronavirus infection here in Philadelphia, which is a reason for concern. I'm going to talk about that. I'll also talk about new CDC guidance for on airborne spread of the virus, new event limits that the governor has announced today, some thoughts about Halloween, and I'll finish with some thoughts about the president's infection. First, though, the numbers. Since this time yesterday, we have identified 250 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 37,812 since the beginning of the epidemic. In addition to that, we had 28 new probable cases that are diagnosed by rapid test only. Now, 250 is a large number, and some of that 250 is because we are getting reports on backlogged cases. We reported 55 cases yesterday. We are having a problem with the electronic transmission of laboratory data to us. Some of our case reports are from more than 7 days ago. But also this large number is part of a pattern of increasing cases. For the past week that ended last Saturday, October 4th, by the date in which the sample was collected, we averaged 110 cases per day. And of those people tested, 3.9% were positive. That's substantially higher than the week before, where we averaged 86 cases per day and 2.9% people were positive. Now, if you have attuned to these previous press conferences, you may notice that 86 and the 2.9% are higher than I reported a week ago. And that is because of those delayed results we're receiving now from the week before. Now, the reasons for this increase in case activity is not entirely clear. We do know that we are seeing continued clusters and spread on college campuses in the city. We're seeing spread at Temple, at Jefferson University, there in particular the undergraduate campus, St. Joseph's University, and some cases at Drexel and at the University of Pennsylvania. In those universities, it appears to be that this is spreading at social gatherings, not being spread in the classrooms. But we're also seeing increases in other age groups, not the college age group, and in other areas of the city, particularly in the far northeast. And it's less clear why we're seeing increased transmission there. Since this time yesterday, we've identified one new death from the coronavirus, bringing us to a total of 1,817 from the beginning of the epidemic. We're averaging now about 15 deaths per week. Then in our nursing homes and other congregate care facilities, we are seeing more viral activity in the past couple of weeks. We were getting 1 to 2 cases per day for all those institutions across the city in mid-September. Now we're getting maybe 3 to 5 cases per day. Now that's not a big increase. Those are not large numbers, but those numbers are still very concerning because people in these situations are very medically vulnerable. In our schools and daycares, there is somewhat better news there. We are continuing to have isolated cases in students and in staff, but we have not yet seen any clusters in the K-12 schools where it is clear that the spread has happened within the school. It appears that most of the cases, and perhaps all the cases, the spread, or the cases are occurring because people are bringing it to the school, but it's not necessarily spreading in the classroom. That's what's happening here in Philadelphia, in Pennsylvania, and in New Jersey, in New York State, and in the United States as a whole. Case rates are now rising. They're seeing college outbreaks in many parts of the country. Those college outbreaks continue, and they are an important reason for this increase, but they're definitely not the only reason. So the overall message now, in view of the increasing cases we're seeing here in Philadelphia and what's happening around us, is that risk is increasing right now. So people should be especially concerned and especially focused on wearing masks to protect yourselves, protect the people around you. I'll talk more about that in a minute. Now, yesterday, the Centers for Disease Control posted new guidance on how the coronavirus, COVID-19, can be spread. This guidance is very carefully written, and I believe it is reflective of the scientific studies as I understand them. And this guidance acknowledges that most of the time, the coronavirus spreads by droplets amongst people who are within 6 feet of each other. However, it can be spread airborne beyond 6 feet, especially in certain situations. That would be especially in enclosed spaces where there's inadequate ventilation, and when people are putting out respiratory droplets or breathing in many respiratory droplets, such as when they're shouting or singing or exercising. So the lessons here is that masks are particularly crucial, and that indoors, ventilation is important. And outdoors, where ventilation is naturally much, much better than it ever is indoors, is going to be far safer than indoors. Now, just this morning, a couple of hours ago, the governor announced new rules for limits on events across the state of Pennsylvania. Previously, the limit was 25 people allowed for an event or gathering indoors, and no more than 250 people outdoors. The new rules that the governor announced today changed the limits, and they're based not on a single number, but instead based on the size of the venue. Indoors, on a very large venue, it could be that hundreds of people could get together for an event, or in very large venues, up to 3,750 people. Outdoors, at very large venues, it could be up to 7,500 people. Now, we do have concerns about this in Philadelphia because we do have unique risks in the city. We have many huge venues, stadiums, concert halls, arenas, a convention center, that draw people from across the region and, in fact, across the entire United States. We also have outdoor spaces that people use for gatherings and events, like, for example, Penn's Landing. We're also the largest, most densely populated city in Pennsylvania. We're the city that's been hardest hit with COVID. And as you've seen now, our case rates are rising. In the past, if we felt that the governor's policies were not safe enough for the city of Philadelphia, we have been more restrictive than the Commonwealth. And we'll continue to be more restrictive if necessary, if we believe it is necessary to protect the people in Philadelphia. So the governor's guidance was just announced a couple of hours ago. We will review the guidance and we will announce what the new policies are for Philadelphia at this press conference next Tuesday. A few words on Halloween. We received many questions about Halloween. We're not attempting to cancel this event. I'm not really sure that it would be possible to cancel such an organic event as that. But we do think that children and families should take actions to stay safe. And we are posting guidance today about how they can do that. The key rules of this guidance are that keep the Halloween activities outdoors where there's good ventilation. It's much less likely to spread. The virus is much less likely to spread, that is. That's number one. Number two, wear masks. When I say masks in this context, I mean masks that prevent COVID, not the scary Halloween kind. And third, people should keep 6 feet away from those that are not in that household, which is to say, don't gather. You can go back and forth from house to house, but don't gather. And finally, don't participate in Halloween activities, either as a trick-or-treater or someone giving out candy, if you are sick with symptoms, or if you've been exposed to someone with COVID recently. And finally, some thoughts about the president. President Trump chose to not wear masks and discourage others from wearing masks, despite medical advice otherwise. And he got infected. That clearly was a mistake. I think we can draw 3 lessons from this. First, that the president should have listened, and we all should listen to the medical advice, which is to wear a mask and ask others around you to wear a mask as well. If you don't do that, you're likely to get infected. It's very simple. Second, testing is not a substitute for masks. I hear and I frequently read suggestions that we need to do more testing, or even the suggestions that if we only tested people more, we don't need masks. And in fact, yes, we do need to do more testing, but testing by itself does not prevent the spread of COVID. The president was tested every single day, perhaps even more than once a day. And people in the White House, though, they didn't wear masks, even indoors. And in fact, the testing may have hurt that situation because the president and others thought that they were tested often enough that they didn't need to wear masks. Just remember this. So testing is not a substitute for masks. Remember that. Testing is not a substitute for masks. The third lesson is that you should be afraid of the coronavirus. I strongly disagree with the president on this one. The coronavirus has killed more than 200,000 people across the United States of America and killed more than 1,800 people here in the city of Philadelphia. COVID put the president of the United States into the hospital. Now, his chance of dying is about 5%, which means he'll probably recover, 95% chance he'll recover, and I certainly hope that he does. But I would not recommend that anyone take a 5% chance of dying. That's 1 in 20. I would not recommend that anyone take that chance. All those 3 lessons add up essentially to the same lesson, which is wear a mask. This simple technology can protect us against this virus. Wear it whenever you're around people who are not your household members. Thanks very much. If you want more information, go to our website, www.phila.gov/COVID.
Thank you, Dr. Farley. And now we will move to Armando for the Spanish language translation of the mayor's and Dr. Farley's comments.
Any new reopening dates being pushed back a week for the school district? Any concerns on the reopening of hybrid reopening of schools?
If you're talking about the plans of the public schools, the school district of Philadelphia, you have to talk to them. We are speaking to them, and still is our position that the schools can reopen safely.
Hi. First, a question for Dr. Farley, you mentioned that there are clusters in college students and also a rise in cases in the Northeast. Are cases in other age groups other than college students spread throughout the city, or are they clustered in the Northeast at this point?
It does appear that we're seeing increases across the city. It's not only in the Northeast, and it does appear to be many age groups. It's not just the college age group.
Would you have any reason to believe at this point that it's linked to, the opening of indoor dining or other reopenings that the city has allowed?
We're looking for that when we're doing our contact tracing to see if there's evidence that there was people, say, multiple diners together who got infected, or multiple cases associated with one restaurant. So far, we're not seeing evidence of that. It can be something we can miss, but so far we're not seeing evidence that it's linked to the indoor dining.
Okay, and one last question about the Halloween guidelines. What are guidelines for people who would want to pass out candy to trick-or-treaters? How should that be done?
That's included in the guidance. Basically, they should be keeping their distance from the children, ideally having the children grab the candy themselves. I think you have to look, I forget the details, but the main thing is keeping the distance from the children who come up to the house.
All right, I got 3 questions on behalf of my team. First is going to be for Dr. Farley. I know that many, the Wolf's order has been, or outdoor gathering order has been thought about in mostly the sport arena. I know you said next Tuesday is when we're going to get your specific recommendations, but before that, what's your updated advice on people who want to go to outdoor weddings and larger events, specifically around weddings and those type of social activities?
So Manny, you broke up. I didn't get entirely the question, but I understood the question to be, what do I recommend for people doing gatherings in the meantime, particularly around weddings? Say social gatherings are the major way in which the virus is spreading right now amongst people in Philadelphia after households. All right, mainly, first it's being spread within households, and then it's being spread at social gatherings. So I would recommend people be very cautious about social gatherings, especially social gatherings indoors. People, when they're gathering for weddings or other social gatherings, they tend to eat or drink. When they're eating or drinking, they're not wearing masks. A group of people indoors not wearing masks is exactly what we're mainly concerned about. I would recommend if people gather at all, that they do it outside, that they limit their numbers. Our limit in Philadelphia is still less than 150 people outdoors, that they wear masks and they keep 6 feet from each other.
Hi, I have 2 quick questions for Dr. Farley. I was wondering, Doctor, are you comfortable with the city hosting any sort of large outdoor events, such as, say, hosting games at Lincoln Financial Field or reinstating tailgating?
And right now, we are not. Right now, our limits for outdoor gatherings are 150 people. As I said earlier, the governor changed his rules, and we will look at those and we'll announce what our policy is for those next Tuesday.
Okay. And just to follow up, I was wondering, what were your specific concerns with, say, large outdoor events if people are socially distanced? Just what are the risks there?
The risks are that people will still, if they get in a crowd, they'll still get closer than 6 feet together, that they'll take their masks off in the excitement of the moment. And if you have hundreds or thousands of people, there's a huge number of people that could be exposed at a single event. Those can really greatly influence the course of an epidemic if they do have that level of exposure.
This question is for Dr. Farley. In regards to the large gatherings, this is a 2-part question, so it's technically 2 questions, but what will you consider when making your decision? Just kind of what's the list going through your head of things that you have to consider? And secondly, what types of gatherings are you talking about? Is the Christmas Village and parades that were originally canceled, is there a possibility that they could actually come back?
Well, yes, as far as the first question, we'll look at the size, the number of people involved, the density and the location, and whether protocols can be put in place and enforced in which people are wearing masks and keeping distance from each other. And the difference between indoors and outdoors is very important here, as I mentioned earlier with the airborne. as far as what events that might have an impact on when we come up with a decision, I really can't say at this point.
Yeah, and let me just add something else. Philadelphia obviously is the largest city in the Commonwealth of Pennsylvania. We have different issues and different problems as compared to someplace in a small town in the center of the state or along the northern tier. So when the governor and folks are getting pressure from legislators and others to do certain things and to kind of open up more, it's coming from areas that aren't experiencing the type of infection that we're experiencing. Even Pittsburgh's, I think, half our size. So you can't apply one standard to Tioga County that you would apply to Philadelphia County. And I think that's the difficulty in articulating our issues to the public is that, well, the governor said we can open up, so let's just open up. It's not that easy, and it's much more complicated. And when you're making decisions based on people's health and life and death, you better make sure you're right, or at least reasonably right, before you jump in. And that's why we're hesitating. We didn't find out about this change in guidance or change in regulation until late yesterday afternoon. We have a lot of calculating to do and figuring out how we keep people safe while accommodating people's desires to socially be around each other.